morning. I'm Dr. Manu Gautam. I'm Senior Consultant for Orthopedics and Joint Replacement in Dharamshila Narayana Hospital. So today we'll be discussing about sports injuries, common sports injuries which happens to our players, even if you are doing it on a professional basis or recreational. So people who are doing recreational sports activity, they generally do not do proper warm-ups, and that is the reason they get injuries very frequently as compared to the people who are doing it on a professional level, because they do follow proper protocols. So what all are the sports injuries? Generally there are few injuries. If we let's go by from a joint to joint. So knee injuries most common are meniscal injuries or cruciate ligament injuries, anterior cruciate, that is ACL injuries or PCL injuries. What are these injuries? We'll discuss it later. Shoulder injuries, there may be rotator cuff tear, there may be shoulder dislocations, elbow injuries, wrist ligament injuries, fractures, and many other things. So we can quantify it with acute injuries and chronic injuries. Acute injuries may have fractures, ligament tears, ligament sprains, then strains, and sometimes complete tears. Chronic injuries do happen when we keep doing the same activity again and again, that is overuse or misuse, which can result in chronic, slowly tears of the associated ligament or muscles, which can be in the specific region. Throwers, javelin throwers, boxers, all these people get injuries in their shoulders. Basketball players, football players, cricket people who are constantly running and twisting around, they generally do get more of their ankle and knee injuries as compared to shoulder injuries. Shoulder injuries are more common in people who are into throwing activities, bowlers, javelin throwers, etc. etc. So coming up to knee injuries. So very common injury in knee is a meniscal injury. What is meniscus? So first we need to know what is meniscus and what are these injuries and how do we treat those meniscuses. So what is a meniscus? So if this is a knee joint, so it is protected by a washer. So there are two washers in our knee. One is on the medial side, the bigger one, it is called as medial meniscus. The other one is a small one, O-shaped, it is an lateral meniscus. So it's a washer. Meniscus is a washer which keeps a cushioned area, which provides a cushion to our knee, the two bones. So any impactful injuries, twisting injuries can cause a tear in the meniscus. So what do we do when we get a meniscal injury? So meniscal injury can be graded, grade 1, grade 2, grade 3. So early and small meniscal injuries generally heal on their own with a good amount of rest and some medications. So but if there is a tear and it is becoming painful in getting up from the activities, what all are the symptoms of knee pain or a meniscal pain? Getting up from the chair, climbing up the stairs, locking of your knee if you flex it. अगर आप घुटना मोड़ के बैठे हैं and you suddenly get up, a feeling of locking sensation, these are indirect signs that you might have a meniscal injury. So what do we do? Should I opt for a meniscectomy or a meniscal repair? So what are the differences? So meniscectomy is we shave off the torn part. We do not repair it. We take out the part, we balance the meniscus and we trim out the part which is torn. It is mainly done in complex injuries or if the injury is in a white zone. White zone मतलब अंदर वाली zone में जहाँ blood का रिसाव कम है. तो blood vascularity के हिसाब से we divide the zones into meniscus. The outer zone is red zone, the inner zone is white zone. The middle zone is red white zone. Any injuries in the white zone, if we think they are not repairable, so we trim it out and we do the meniscal balancing. That is called as meniscectomy. When a doctor tries to repair your meniscus, it is called as meniscal repair. So there are many modalities available with us because of the advancement of science to repair your meniscus, and we can heal it after some rest. So generally we do not allow weight bearing to the patient after meniscal repair for a few weeks, 3 to 4 weeks, and eventually start slow weight bearing, and meniscal repair do heal very well. So meniscus is important structure. Any meniscal injury should not be ignored. If we ignore our meniscus, we get patients who have ignored their meniscal injury and they come after years. The result is degeneration of the joint. It's a protective structure. If it is not there, there will be friction, there will be more chances of developing arthritis as compared to the young patients. So we have ACL and PCL injuries. So what is an ACL and PCL? So this is our tibia, this is this bone, and this bone is, let's say, this bone. तो ये slide करेंगे एक दूसरे के ऊपर and you will not be able to walk. So there are two ligaments, one going from here to there, another there. They lock each other and they lock your knee into a stable fixation कि आपका knee सिर्फ एक particular movement में move कर सके, आगे पीछे ना हो. तो this movement which is prevented by these two structures are very important. So these structures are ACL and PCL. So this ligament which prevents your knee from going anteriorly, आगे खिसकने से रोकता, that is ACL. The one which is here posteriorly which prevents your knee from sagging behind is called PCL. And there are two more ligaments on the side of the knee. This is MCL which prevents this much toggling. अब ये टूटा हुआ है तो our knee can open up. But the LCL is right now intact, lateral collateral ligament, तो हमारा knee नहीं खुलेगा ज़्यादा. But MCL अगर हमारा ये MCL यहाँ intact होना चाहिए था, ये टूट गया तो there will be instability. So ACL, PCL, MCL, LCL, these four ligaments provide stability to the knee. Any injury in these regions will cause instability more than pain. Meniscal injuries are more associated with pain. The main sign of an anterior cruciate, posterior cruciate, or MCL, LCL is instability while walking fast, while climbing down the stairs, or up and down the slope. So these are the basic indications you will get to know when you have an injury, and you will get to know कि मेरे को meniscal injury है या मेरे को ACL, PCL यानी cruciate injuries है. Instability in ligaments and meniscus में pain. These two signs will give you an indication that you have injured your knee. You should go and consult your doctor for it.